Okay. Good evening. How are you feeling today? Are you well? Does anything hurt? Right. Okay. Of course, that's understandable. You went through a surgery. Now, we are just preparing some papers to possibly release you very soon. So that's good news. So I do have to do an exam and make sure that all of your body is okay and you're ready to go home. Is that okay with you? All right. What does it involve? Blood pressure, oxygen levels, fever. There might be a few things. I might need to touch you in a few places, and as I go along, I'm going to record all of this. Is that okay with you? There might be a few things I'm gonna ask you and tell you and warn you. If there's anything you're uncomfortable with, please let me know, okay? Okay, so first things first, let me put this down for a second, and I think we need to make sure you don't have a fever or an infection anywhere, okay? So just relax. It's working. Okay, just over here. You are perfectly well. You have no fever. That's a relief. Let me just make sure I write it down. And the next thing, we have to check your blood pressure. Oh, I forgot, I already prepared the machine. You have it right beside your bed. You were sleeping. I didn't want to wake you up at that time. Do you mind if I sit down just beside you over here? Just give me your arm. Don't worry, this one is not painful, and I do recommend that when you are going through it, you try and relax and breathe, because sometimes I just propped you up a little bit. I think you had a lot of visitors. Quite a few things on the table over there. Yes, so yeah, just try and relax, and this one is not painful at all. Okay, let me just turn it on. Okay. No, that is perfectly well. Okay. 120 by 80, that's the perfect blood pressure, in the West at least. Okay. Now next thing is, I'm going to look at the oxygen levels in your body. Gonna make sure that it's all okay. We need to go through all the tests. We need to make sure that you can go home. Okay? You would rather be safe than going home when you're not 100% well, right? Okay, so just give me one of your fingers over here. Just basically what I'm gonna do is I'm gonna do this and press the button. Okay? Just over here. Okay. Okay. Just relax. And breathe. And relax. Okay, your heartbeat is a little bit fast, but that's possibly because you're a little bit nervous right now, are you? It's nothing to be worried about. Everything is okay, alright? Let me just write down your measurements over here. Okay, oxygen level and the heartbeat. Okay, so next I'm going to look at your ears. Okay, just over here I have the machine. well, the pen really kind of turns it on and allows me to see inside your ear. Okay, let me just look at this one first. Okay. Okay. I'm gonna do a little ear test as well. Let me just look at the other one quickly. Okay. Now, there's nothing serious, but I do think that once you leave the hospital, you might need to clean your ears. There's nothing to be embarrassed about. Absolutely, yes. Can I do actually a quick hearing test, if you don't mind? I just want to make sure, yeah, that everything else that is just the cleaning that you need. Right, actually, I'm just going to put my gloves on as well. So, I want you to close your eyes, okay? Just close your eyes. Right. And then now, please tell me from which side do you hear the sound, okay? Okay, which side was it? Okay, and now. Which side is it now? Very good. Okay, let me try again. Okay, what can you hear? Perfect, on that side. Now, I'm gonna whisper a word in your ear, and I'd like you to tell me what you can hear, okay? Let me just get a little bit closer. You don't mind me leaning on you, do you? Okay. Light. Okay, which ear was it? And what word was it? Okay. Pillow. What word could you hear? Okay, perfect. And then just the other ear. Okay, sorry, I need to... Yeah. Okay. You ready? Okay. Window. What word did I say? Okay, good. All right. Now, air. Okay, which ear? And what word? Perfect. You can open your eyes. Let me just note it. It's gonna be in your notes. The doctor is gonna give it to you. No, I'm just a nurse. Right. Now I'm just gonna make sure that your eyes are okay. Alright, so be careful. I'm going to turn on the light. You don't mind it, do you? Okay. Alright. So I want you to focus on my face, okay? Just look at my nose, okay? And I'm just gonna do this. Tell me if anything feels a little bit uncomfortable, okay? Okay, just, yeah, I can see that your focus is shifting. Focus on my nose, okay? Okay, let me just come a little closer. I'm gonna lean on you again, okay? Now look at the light. Look at the light. Focus on it if you can. Hurt your eyes a little bit. Okay, I'm gonna stop. I don't see anything worrying there at all. Okay, let me just write down the last results. Right, so now I'm going to touch you, if you don't mind, in different parts of your body. I'm going to start with your head and your ears and, yeah, other parts as well. Yeah, that's okay? Right, okay. So when I touch you, tell me what you feel and if you can feel anything. And if you feel any pain at all, please make sure you let me know, okay? If you don't mind me sitting down beside you here. Alright, okay. Okay. Can you actually close your eyes for me, please? Just close them. Right. Now, can you tell me what side of your face am I touching? Okay. And now, okay, what side of your face was it? Okay, and again. Okay. Okay, and again, please. Okay, that seems perfectly normal. Right, and now I'm just gonna touch just to feel it, okay? Tell me if anything hurts in your ears, just over here. Okay. All okay. All right. So it doesn't seem to be any problem with your head. Okay. Now let me examine your legs and your arms. Please tell me if it hurts, okay? Right. I'm just gently gonna touch you first. And if nothing hurts, I might have to go deeper, okay? Tell me again if anything hurts, okay? Don't mind me leaning on you, I hope. Doing well? No pain? Okay. Let me just do a little bit of this type of movement. Sometimes it might make a difference. That's okay. Okay, so okay. Now let me gently go under the blanket, okay? I just want to check the affected area in particular. How does it feel? Okay. No, I'm not touching directly the, yeah. I just want to touch the areas around it, make sure it's okay. I think the wound is healing well. Yeah, doing pretty well. Do you experience much pain when I'm doing this? Okay. That is very good news. Absolutely. I do think that you are nearly ready to go home. Now, I do have to write down the whole report first. I have to do it for everybody. There's nothing different, so I can't actually guarantee that you can go home tomorrow, but I'm going to finish the report today. I'm going to submit it to the doctor and you'll be notified tomorrow first thing in the morning. Is that okay for you? Perfect. So that's it for today. You can enjoy your rest and relax. You're definitely staying here today, as you know. So it's just hopefully that tomorrow afternoon, if you let you know by the morning time, you can go in the evening, so you can call your family if they need to pick you up, or perhaps you need to organize your transport in a different way. Okay? All right. Thank you for being so patient, and good night.